Hello, Brain Shakers. Welcome to the Brain Shakers Academy. Thank you for joining me on today's episode where we're going to be looking at a continuation on the breech presentation. And today we're going to be looking at fetal positions when you have a breech presentation. So before we even go ahead and look at those fetal positions, it is important that we know what the attitude is, we know what the lie is, we know what the denominator as well is going to be. In a cephalic presentation, we were busy talking about the occiput being the denominator, but when it comes to a breech presentation, we're obviously talking about the sacrum being the denominator, and we can have the attitude being that of complete flexion. That is when you have a completely flexed breech. So you may have that situation where the baby is completely flexed, and we have an engaging diameter here, which is obviously going to be the Bitronchanteric diameter, which is a 10 centimeters diameter. And then the lie is going to be longitudinal because little one is going to have the fetal spine parallel to that of the maternal spine. So those are some of the things that we obviously need to know. We know that the engaging diameter when the fetal breech reaches the pelvic brim is going to be the Bitronchanteric diameter, but when the fetal arms here reach the pelvic brim, it will now be the bisacromial diameter that will be there. And then when the fetal head then engages, it could be two diameters. You may have the suboccipital bregmatic, or you would have the suboccipital frontal diameter that is more of slightly deflex, or it will be a flexed head like that. So we'll look at all that when we come to look at the mechanism of a spontaneous breech delivery. Now we are looking at positions. So just like a cephalic presentation, you have posterior positions and you have anterior positions and lateral positions. So if we have our pelvis right here, we know that right on this end here, this is going to be the posterior aspect. And where we're talking about and looking at the symphysis pubis here, this is going to be the anterior aspect, and on the sides here, it is going to be the lateral aspect. So the things that are only changing here is that we have replaced the denominator from the occiput, we've replaced it with the sacrum, and then this obviously is going to be maternal right, and this is going to be maternal left. So all that still remains the same. The posterior is still the posterior, the anterior is still the anterior. Now let's quickly go ahead and look at that. We already know our attitude, we already know the lie, we already know what our denominator is. So we know that the sacrum is here, and if it is pointing towards the posterior aspect, which is the right sacroiliac joint, then it means that we now have what we are going to refer to as the right sacro-posterior. So right sacro-posterior. And when it is pointing towards the left side, that is, the sacrum is pointing on the left side of the sacroiliac joint, then what we are going to then have is going to be the left sacro-posterior, because we are still in the posterior aspect. The moment it rotates and then comes to lie in the lateral aspect, and you will be able to even feel the bitronchanteric diameter there in the anteroposterior diameter, then you will know that the position that you are dealing with is the left sacrolateral position. The same as well when it is lying in the other side, or the sacrum pointing towards the right this side, then you will have the right sacrolateral. And when it is pointing towards the anterior aspect, now you're going to have the sacrum pointing towards the iliopectineal eminence there. Then on the right side, you will have a right sacro-anterior. And when it is pointing to the left iliopectineal eminence there, then it means you're going to have the left sacro anterior. So those are some of the positions that the fetal breech is obviously going to take as it comes in to negotiate the birth canal and pass through the pelvic brim. It will still obey and follow the principles of labor, that is, descent and impaction will continue to happen, and whichever part is going to be the leading part then will be forced to rotate 1/8 of a circle, which is about 45 degrees, and then will be forced to come and pivot under the subpubic arc here, and when it pivots here, then that is more or less what we see in a cephalic presentation, which is the extension and the crowning that we see there. So the breech now will actually come and ramp up under the symphysis pubis here, where you have this subpubic arc here. So those are some of the positions that you would be talking about when you are looking at a breech presentation. And what only changes is the denominator. In a cephalic presentation, you obviously be looking at the occiput as your denominator, but when it comes to a breech presentation, you're obviously looking at the sacrum as your denominator. The posterior still remains the posterior, the anterior is still the anterior, the lateral is still the lateral, maternal right and maternal left is still maternal right and maternal left. Now, if you found this particular video helpful in understanding some of those positions that the breech is obviously going to take, don't hesitate to drop me comments in the comment section. I would love to hear from you. And also, don't forget to share the video as much as possible. Follow the page, subscribe to the YouTube channel, hit the notification button so you don't miss any of the nice and amazing stuff that is coming your way. And as always, thank you so much, and I will see you in the next one.